Hi, I'm Dr. Rashmi Swaroop. Today we'll be discussing about which patients needs a diagnostic hysterolaparoscopy. Now, what do I mean by diagnostic hysterolaparoscopy? Couples with prolonged years of marriage, 5 years, 6 years, still not able to conceive. All the other tests are normal. So, certain things which we cannot see by a scan or any other blood test will be seen directly going into the abdomen and into the uterus. So we put a camera inside the uterus and into the abdomen and see how the tubes are placed, whether there's any damage in the tubes or how the cavity is there inside, whether there's any abnormality in the cavity. These things are assessed by doing a diagnostic hysterolaparoscopy. Now we'll see what all things we look for in diagnostic hysterolaparoscopy. Now coming to first hysteroscopy, what do we mean by hysteroscopy? That is looking into the cavity of the uterus. We are negotiating through the cervix. We are going into the cavity where we assess how the cavity is, how the tubal openings is and how the glands are. So coming first, here we are assessing how the endometrium is. See, you can see a localized thickening here and there of the endometrium, and that the black hole over there is the ostia. The whole thing is the cavity. We are looking in the anterior wall of the uterus where there are little thickening. The white spots over there are the endometrial glands, and general assessment of the cavity, endometrium and both the tubal opening leading to the fallopian tube. Those black spots are the fallopian tube. Once the hysteroscopy is done, then we move into the laparoscopy, which is done parabdominally. Coming to laparoscopy, the central muscular portion is the uterus. The white structures over there on either side are the ovaries, and the tubes, the elongated structures on the either side are the tubes. Now we push the dye from below, the blue dye called methylene blue, and look for whether the tube is patent. You can see the blue dye coming out from the left tube. And not only tubal opening, we also assess how good is the tube to do the pickup of the oocytes. So we are assessing the caliber of the tube, whether there is any dilated tortuous. This is a normal tube, so the structures, how it accompanies the tube